You may flinch when you hear a child crying, but this is one of the most wonderful sounds a parent can hear. It's a child being protected. From before newborn babies leave the hospital until they are in their teens, immunizations against 9 diseases are recommended. It is important to remember that modern medicine can protect children against a host of illnesses only if the vaccines are taken. But before parents can arm their children against diseases, they need to arm themselves with knowledge.
Immunizations, what you know.
This videotape will help parents understand the need for vaccinations against certain diseases, how the vaccinations work, and the results and reactions that are possible with each immunization. Later in the program, it will also give parents a complete recommended schedule for vaccinations. Parents should use this videotape for information only. It should not be considered a substitute for advice from a physician. Talk to your medical caregiver if you have questions about vaccinations.
Well, immunizations protect your child against many diseases, such as diphtheria, pertussis, tetanus, polio, measles, mumps, rubella. All of these diseases back in the 30s and 40s used to kill tens of thousands of people every year, and those that they didn't kill, they left maimed or injured for life. It's a parent's responsibility to make sure that the children get these immunizations to protect them. Now, these immunizations don't work very well below a year of age. They have to be given very frequently. They don't work very long. You have to get shots at 2 months and 4 months and 6 months and again at 15 and 18 months. Also, this is an ongoing problem. We've had a recent outbreak of measles. In the last 5 to 10 years, we've had tens of thousands of children with measles, and several children have died every year. This is partially because people aren't getting their child immunized. We need all of our population immunized. If we'd only have 50 to 60% of them immunized, those 30 to 40% are protected, and the ones that are immunized aren't. If we get everybody immunized, we can protect our children from that, but it's the parents' responsibility to make sure their children are up to date and vaccinated. If not, we have an ongoing problem.
Immunizations, or vaccinations, are medical science's way of building defenses against certain diseases. The vaccine actually puts small amounts of the disease-causing organism or its products into the body. This causes the body to form antibodies that will fight that disease for months or years. Vaccines have both benefits and risks. Most problems that occur after vaccines are mild, but a few people may have a more serious reaction. Experts note, however, that existing vaccines are safe and more than 95% effective.
Diphtheria, tetanus, pertussis.
Usually the vaccines for these diseases, diphtheria, tetanus, and pertussis, are combined into one shot. That is called the DTP vaccine. Diphtheria is a very serious illness. In children below 15 years of age, it can cause them to not breathe, and in severe cases may be paralyzed or have heart failure. Tetanus is sometimes called lockjaw, and for good reason. People with tetanus are unable to open their mouths or swallow and may have serious muscle spasms. Pertussis is commonly called whooping cough. It is most dangerous to babies less than a year of age. It can cause spells of choking and coughing and make it difficult to drink, eat, or breathe. It could even lead to pneumonia or brain problems and death. It cannot be treated. Medication is mainly used to prevent others who come in contact with a patient from acquiring the illness.
A series of 5 DTP shots is usually given at 2 months, 4 months, 6 months, between 15 and 18 months, and between 4 and 6 years. They protect most recipients from getting diphtheria and tetanus for at least 10 years. Studies show that 70 to 90% of the children who have at least 3 of the DTP shots are protected from pertussis through their elementary years. Those who have had the DTP immunization and still contract pertussis usually have a milder case of whooping cough than if they had not had the vaccine. The most common reactions to the DTP vaccine are fever, or soreness, swelling, and redness where the shot was given. Some children are cranky and may not want to eat. Usually these problems are mild and last 1 to 2 days.
It is important for parents to watch for reactions after any vaccine, but especially the DTP vaccine. After the DTP vaccine, if your child has a serious reaction and we give that vaccine again, we may do permanent damage to your child.
Parents should call a doctor if a child suffers serious reactions. They include a crying spell that lasts more than 3 hours, an unusual high-pitched cry, a temperature of 105 degrees Fahrenheit or 40.5 degrees centigrade or higher, unresponsiveness. A few children may have a seizure or convulsion, often caused by a high fever. The vaccination should be delayed if a child is sick with something more serious than a common cold, or has ever had a convulsion or other brain problems. A doctor should decide when or if the child should ever get the DTP vaccine.
Hepatitis B.
The hepatitis B virus can be tricky. Children may become infected and not know it for years or decades later until they develop liver problems. In fact, as many as half of people who have the virus have no idea when or where they became infected. Hepatitis B can cause infection at any age, but young children who are infected are most likely to develop a chronic liver infection and serious liver disease, especially if they get it during infancy. In fact, if you were infected today and got the vaccine within the next 6 months, it might protect you from getting the illness or passing it on to others.
More than 95% of the children who receive all 3 recommended doses of the hepatitis B vaccine are protected against illnesses caused by the hepatitis B virus. The vaccine is usually given before baby leaves the hospital, at 1 to 2 months, and at 6 to 18 months. The most common side effects that sometimes occur after a hepatitis B vaccine are fussiness and soreness, swelling, or redness where the shot was given. These reactions are usually mild and temporary, lasting 2 to 3 days. No serious reactions have been linked to this vaccine.
Polio.
Polio usually strikes children from 1 to 16 years of age. It leaves some children paralyzed and some may even die. In some cases, polio causes severe muscle pain and may make it difficult for victims to breathe. In milder forms, a child may have a sudden fever, headache, and a sore throat.
There are 2 types of polio vaccine. Oral polio vaccine, known as OPV, uses a live but weakened polio virus. Most experts recommend this oral vaccine for children because it is easier to take and more effective than the other polio vaccine. The other is a shot. It's called IPV, which stands for inactivated polio vaccine. Inactivated means that the polio virus used in this vaccine has been killed. This shot is recommended when the person getting the vaccination or a close family member has problems fighting infection. The polio vaccine is usually given at 2 months, 4 months, between 15 and 18 months, and between 4 and 6 years. At least 90% of the people who receive 4 doses of either form of the polio vaccine will be protected. The polio shot can cause a little soreness and redness where the shot was given. It is temporary. Rarely does the oral polio vaccine cause any serious effects. There have been reported cases of the person taking the drops contracting polio. There have also been reports of polio in people who have close contact with a person who takes the drops. Once again, however, there is an extremely small chance of acquiring polio from receiving the vaccine. Only those who have not already been protected are generally at risk. Polio vaccination should be delayed if the person receiving it has something more serious than a common cold.
Malicious B.
Haemophilus influenza B is not the flu, but a dangerous type of bacterium known as Hib. It is responsible for a number of serious diseases in children, most commonly meningitis. Meningitis is a life-threatening disease involving the membranes that cover the brain and spinal cord. Hib can also cause epiglottitis, which can cause a child to suffocate. Hib has led to pneumonia, blood infections, and arthritis.
90% of infants who receive 3 doses of the vaccine have long-term protection against Haemophilus influenza B diseases. However, it does not protect against diseases caused by other types of Haemophilus bacteria, and the vaccine does not protect against meningitis caused by other bacteria. The vaccination may cause swelling, redness, and soreness in the area the shot was given. The vaccine should not be given to anyone who has an illness more serious than a common cold.
Measles, mumps, rubella.
Vaccines to protect against measles, mumps, and rubella are combined in one shot known as the MMR vaccine. Measles is a very serious illness that is easily passed from one person to another. It is very hard on babies and adults. This disease causes a rash and can lead to ear infections and pneumonia. Mumps can sometimes be a very serious illness. Glands along the side of the jaw swell, and this can last for several days. It can cause a mild inflammation of the coverings of the brain and spinal cord. Rubella is also called the German measles. It is usually a mild disease, but it is extremely dangerous for pregnant women. Up to half of pregnant women who catch rubella lose their babies or have babies with birth defects. People who do not have the rubella vaccine are in danger of catching it and passing it on to a pregnant woman.
A combined MMR shot protects nearly everyone who receives it against all three diseases, provided their timing is right. Usually, the first shot is given when a child is 15 months old, but it could be given even earlier if there is an outbreak. Experts have different recommendations about the second dose. Some suggest it be given between 4 to 6 years of age. The American Academy of Pediatrics recommends your child have the second dose when he or she is between 11 and 12 years old. Most who get the MMR will not have reactions. Others may have minor reactions, such as soreness or redness for a couple of days where the shot was given. If problems do occur, they are usually after the first MMR shot. More serious reactions from the measles vaccine may occur 1 to 2 weeks after the vaccine was given. They include a rash and or a fever of 103 degrees Fahrenheit or 39 degrees centigrade. Children between 6 months and 6 years, in rare cases, have had convulsions. Parents should contact a doctor should any of the serious reactions occur. A side effect from the mumps vaccine that may also occur 1 to 2 weeks after the shot would be swelling of the glands in the cheeks and under the jaw. This is rare. A doctor should be called if this occurs. Serious side effects from the rubella vaccine include swelling in the lymph glands around the neck or a rash. Other reactions include mild pain or stiffness in the joints, swelling in the joints, or a painful numbness, a pins and needles feeling in the hands and feet. Parents should contact a doctor if their child has any of these serious reactions to the rubella vaccine. The MMR should be delayed if the person receiving the vaccine has an illness more serious than a common cold, has trouble fighting infection, or has had an allergic reaction to eggs that required a doctor's attention. Sometimes an egg mixture is used in the vaccine. Immunization should be part of comprehensive health care for every child. Immunizations of preschool children are intended to provide early protection to the most vulnerable group. All states require certain vaccines before a child goes to daycare or school. You should ask your doctor or nurse what vaccines your state requires.
Got another one?
Some parents wonder why so many vaccines are required. Well, the vaccines, if given early, don't last very long. Also, each time we give your child a vaccine, we're building on the last one. If it has been too long since the last vaccine, it may not work like we expect. It is important to keep on that schedule. Your shot record will remind you of when your next shot is due and also give you peace of mind to know that your child is up to date.
Here is a suggested schedule from the American Academy of Pediatrics for immunizing your children. The recommendations change from time to time, so it's a good idea to keep in touch with your nurse or doctor to find out what's best for your child. It is a good idea to keep a record of all shots given, when they are administered, and who actually gave the vaccine. Immunization against hepatitis B involves 3 doses of vaccine, usually beginning before a baby is discharged from a hospital, and another dose when a child is 1 to 2 months old. When your child is 2 months old, he or she should receive a DTP, polio, and the Haemophilus B or Hib vaccines. The 4-month checkup should include the same vaccinations that your child received at 2 months, the DTP, polio, and Haemophilus B. At 6 months, your child should receive a 3rd dose of DTP and depending on the type of vaccine used, a third Haemophilus B vaccination. Between 6 and 18 months, your child should receive his or her third dose of the hepatitis vaccine. Your child may receive a Haemophilus B vaccine between his first birthday and 15 months. This will depend on the type of Haemophilus vaccine used. The first MMR vaccine is normally given at 15 months. However, it may be given earlier in the event of an outbreak of either measles, mumps, or rubella. Between 15 and 18 months, your child should receive another DTP vaccine, along with another polio vaccine. Your child should receive his or her last DTP and polio vaccines between the ages of 4 and 6. Children usually receive another MMR vaccination between 11 and 12 years of age, and a tetanus and diphtheria shot between 14 and 16 years, with the vaccination repeated every 10 years. As part of their comprehensive health care, children receive tuberculin tests usually at or before their 15-month visit. The information in this videotape should not be used as a substitute for medical advice from your pediatrician. Your doctor may recommend variations in treatment based on individual circumstances. Immunizations protect children for years, but they only work if parents make sure youngsters get the vaccinations they need.